Workplace health and safety law exists because, historically, workplaces were dangerous, and employers were not held accountable for that danger. The legislation that governs WHS globally emerged from decades of industrial catastrophe, injury, and death that were preventable, but not prevented because no law required prevention. The regulations that managers sometimes find burdensome are the residue of real harm to real people. Understanding that context does not just provide legal knowledge, it provides the moral grounding for taking it seriously. Today, workplace health and safety obligations are comprehensive, legally enforced, and, in most jurisdictions, founded on principles that apply far beyond the factory floor to office environments, remote work arrangements, and psychological as well as physical well-being. This video covers what every manager needs to know to operate within and lead to a high standard of workplace safety. The first milestone is understanding the duty of care framework. The legal and moral obligations that employers and managers hold toward employees and others affected by work activities. In most jurisdictions, employers have a primary duty to ensure, so far as is reasonably practicable, the health, safety, and welfare of all workers. The phrase reasonably practicable is critical. It does not mean at any cost, but it does mean at a level proportionate to the risk. The greater the risk and the more predictable the harm, the higher the standard of care required. Managers, as officers of the employing organization, typically carry personal duties in addition to the organizational duty. That personal exposure means that ignorance of safety obligations is not a legal defense, and that active compliance and oversight are individual management responsibilities. The second milestone is understanding the major categories of workplace safety obligation. Physical safety covers the traditional territory of WHS: ergonomics, equipment maintenance, fire safety, emergency procedures, hazardous materials management, and prevention of physical injury. In industrial and construction environments, this is the dominant domain. In office environments, it includes workstation design, electrical safety, slip and trip prevention, and emergency protocols. Psychological safety and mental health are increasingly codified as formal WHS obligations in many jurisdictions, including Australia, the United Kingdom, Canada, and parts of Europe. Employers in these jurisdictions have specific obligations to identify and manage psychosocial hazards, job demands, role clarity, relationships at work, organizational change, and workplace trauma. The extension of safety obligations to psychological well-being is the most significant recent development in global WHS law, and managers who are not aware of it are operating behind the legal frontier. Remote and flexible work introduces specific safety considerations. The obligation to provide a safe working environment does not end when the employee works from home. Most jurisdictions with strong WHS frameworks extend employer obligations to home-based work, at least in terms of risk assessment and provision of safe equipment. The third milestone is practical safety management, the operational disciplines that translate legal obligation into safe outcomes. Three disciplines form the core of effective workplace safety management. First, hazard identification and risk assessment, the systematic process of identifying potential sources of harm, assessing the likelihood and severity of that harm, and implementing controls. The hierarchy of controls: eliminate, substitute, isolate, engineer, administer, and personal protective equipment, provides a structured approach to risk reduction that prioritizes the most effective interventions over the most convenient ones. Second, incident reporting and investigation. All incidents, near misses, and hazards should be reported, investigated, and used as learning opportunities. Near-miss reporting, in particular, is one of the most valuable safety management tools available because near misses predict incidents before they cause harm. Organizations with robust near-miss reporting cultures have lower serious incident rates. Third, safety training and communication. Workers cannot comply with safety requirements they do not understand. Regular, role-specific safety training, delivered in accessible language, not just a form to sign during induction, is both a legal obligation and a practical necessity. Here is the trap. Safety compliance is often treated as a documentation exercise rather than a performance discipline. Organizations generate risk assessments, training records, and incident reports primarily to satisfy regulatory requirements without using that documentation as an operational improvement tool. Regulatory compliance and genuine safety culture are not the same thing. The data consistently shows that organizations with genuine safety cultures, where safety concerns are raised and addressed without hesitation, where near misses are treated as valuable intelligence, and where leaders visibly model safe behavior, achieve dramatically better safety outcomes than those that are simply compliant on paper. Your go-to: identify the single most frequently observed safety concern, physical or psychological, in your current work environment. Assess it against the hierarchy of controls. Identify the highest level control that is reasonably practicable and implement it. Then document the action taken. The psychological safety obligations covered in this video connect directly to the bullying and harassment investigation material in this series. Together, they define the modern manager's complete WHS responsibility. Watch them in tandem. The management of psychosocial hazards in the workplace, a relatively new but increasingly legislated category of workplace safety, requires managers to develop a different kind of hazard awareness than is required for physical safety management. Physical hazards are typically visible: the exposed electrical cable, the wet floor, the inadequate ventilation. Psychosocial hazards are often invisible until they manifest as stress, burnout, or mental health conditions. Excessive and sustained work demands, role ambiguity, poor management behavior, organizational change without adequate support, and exposure to trauma or aggression in the course of work. The invisibility of these hazards until they produce harm is precisely why systematic identification and management is necessary. The Work Design Questionnaire, developed by researchers at Bowling Green State University, and variants of it adapted for organizational assessment purposes, provides a validated framework for measuring the psychosocial risk factors most consistently associated with employee mental health outcomes. Organizations that conduct regular psychosocial risk assessments, not just annual engagement surveys, are developing the early warning capability that allows intervention before hazards cause harm. The parallel in physical safety is the hazard inspection that identifies the loose railing before someone falls, rather than the incident investigation that follows. The same preventive logic applies to psychosocial safety. One practical dimension of WHS law that managers frequently misapply is the scope of the employer's duty of care with respect to third parties, clients, visitors, contractors, and members of the public who may be affected by the organization's work activities. In most jurisdictions, the duty to ensure safety extends to all persons who may be affected by the organization's activities, not just to employees. This has implications for how client-facing work environments are managed, how contractors on organizational premises are supervised, and how the organization's products and services are designed to prevent foreseeable harm to end users. Thanks for watching. If you found this useful, hit like and subscribe to our channel for more practical insights. And if you're ready to go further, check out the next video on your screen.